Pathology Exam Preparation Part 1. Which type of necrosis is most commonly associated with myocardial infarction?
The correct answer is coagulative necrosis. This occurs because ischemic injury, such as that in myocardial infarction, causes protein denaturation and enzymatic inactivity, leading to the preservation of the basic tissue architecture for several days. In coagulative necrosis, the affected cells appear firm and pale as their nuclei disintegrate, but the structural framework remains intact. This allows for later infiltration by inflammatory cells and eventual scar tissue formation. By contrast, liquefactive necrosis is seen in the brain and other tissues with high enzymatic activity, where rapid digestion of tissue leads to a liquid consistency. Fat necrosis is commonly associated with pancreatitis, while caseous necrosis is a hallmark of tuberculosis, producing a cheese-like appearance due to the granulomatous inflammation. Understanding this mechanism not only highlights the unique cellular response of the heart, but also emphasizes the critical role of timely intervention to restore blood flow and prevent irreversible damage.
Which immune cells are primarily involved in granuloma formation?
The correct answer is macrophages. Granulomas form as a protective mechanism when the immune system tries to isolate and contain a persistent irritant, such as an infection or foreign substance. In this process, macrophages play a central role by engulfing the offending agent. They often differentiate into epithelioid cells, which are specialized macrophages with enhanced ability to secrete inflammatory mediators. Some macrophages also fuse to form multinucleated giant cells, another hallmark of granulomatous inflammation. Granulomas are typically surrounded by a collar of lymphocytes, which contribute to the immune response by releasing cytokines to recruit and activate macrophages. Neutrophils are more involved in acute inflammation, while eosinophils are characteristic of parasitic infections and allergic reactions. Granulomas are commonly seen in diseases like tuberculosis, sarcoidosis, and certain fungal infections. Recognizing their formation and underlying causes is essential for diagnosing and managing these conditions.
What is the main pathophysiological mechanism in acute respiratory distress syndrome, ARDS?
The correct answer is alveolar capillary barrier damage. ARDS is a life-threatening condition characterized by severe inflammation and increased permeability of the alveolar capillary barrier, leading to fluid leakage into the alveoli. This results in impaired gas exchange, reduced lung compliance, and severe hypoxemia. The damage is typically triggered by direct insults, such as pneumonia or aspiration, or indirect insults like sepsis or trauma. The key cellular players in this process include neutrophils, which release proteases and reactive oxygen species that damage the barrier, and inflammatory cytokines, such as IL-1 and TNF-alpha, which amplify the response. The resulting pulmonary edema contributes to the hallmark symptom of ARDS, severe difficulty breathing. Understanding this mechanism underscores the need for interventions like mechanical ventilation and treatments targeting the inflammatory response to improve outcomes.
Which tumor marker is commonly elevated in hepatocellular carcinoma?
The correct answer is alpha-fetoprotein, AFP. AFP is a glycoprotein produced by the fetal liver, and its levels decrease after birth. However, in certain pathological conditions like hepatocellular carcinoma, HCC, AFP levels can rise significantly. This elevation occurs because cancerous liver cells regain the ability to produce fetal proteins. While not specific to HCC, AFP is a valuable marker for screening at-risk populations, such as those with chronic hepatitis B or C, and for monitoring treatment response or recurrence. Other markers, like CA and Te19-9, are associated with colorectal and pancreatic cancers, respectively, while CA125 is typically linked to ovarian cancer. The use of AFP in combination with imaging techniques helps improve the early detection of HCC, which is crucial for effective treatment.
What is the hallmark histological feature of Parkinson's disease?
The correct answer is Lewy bodies. Lewy bodies are abnormal aggregates of the protein alpha-synuclein found within neurons, particularly in the substantia nigra, a region of the brain critical for motor control. These inclusions disrupt normal cellular function, leading to neuronal death and a decline in dopamine production. This dopamine deficiency underlies the hallmark motor symptoms of Parkinson's disease, including tremors, rigidity, and bradykinesia. In contrast, neurofibrillary tangles and amyloid beta plaques are associated with Alzheimer's disease, while spongiform changes occur in prion diseases. Identifying Lewy bodies through postmortem histological examination confirms a diagnosis of Parkinson's disease, but clinical diagnosis relies on symptom assessment and imaging. By understanding these histopathological features, researchers can continue developing treatments targeting the underlying mechanisms of the disease.
What is the primary genetic mutation in cystic fibrosis?
The correct answer is the CFDAR gene mutation. Cystic fibrosis is caused by mutations in the CFDAR, cystic fibrosis transmembrane conductance regulator, gene, which encodes a chloride channel protein critical for maintaining fluid and electrolyte balance in epithelial tissues. The most common mutation, delta F508, results in a misfolded protein that is degraded before reaching the cell membrane. This leads to thick, sticky mucus in the respiratory, gastrointestinal, and reproductive tracts, causing chronic respiratory infections, malabsorption, and infertility. Other mutations in the CFDAR gene can cause varying degrees of dysfunction, contributing to the disease's clinical heterogeneity. Early diagnosis through genetic screening and treatments like CFDR modulators have significantly improved outcomes for patients with cystic fibrosis.
What type of hypersensitivity reaction is involved in systemic lupus erythematosus, SLE?
The correct answer is type 3 hypersensitivity. In SLE, immune complexes formed by autoantibodies and antigens circulate in the bloodstream and deposit in tissues, triggering inflammation and organ damage. This immune complex deposition primarily affects the kidneys, joints, and skin, leading to symptoms like lupus nephritis, arthritis, and the characteristic malar rash. The activation of the complement system and recruitment of inflammatory cells amplify tissue injury. Type 3 hypersensitivity differs from type 2 hypersensitivity, where antibodies target specific cells, as seen in autoimmune hemolytic anemia. Type 1 hypersensitivity involves immediate allergic reactions, while type 4 is cell-mediated and delayed, as seen in conditions like contact dermatitis. Understanding the mechanisms of SLE helps in managing its systemic effects with immunosuppressive therapies.
What is the most common cause of nephrotic syndrome in adults?
The correct answer is membranous nephropathy. Membranous nephropathy is characterized by thickening of the glomerular basement membrane due to immune complex deposition, often with subepithelial spikes visible on electron microscopy. This condition leads to the classic features of nephrotic syndrome, including severe proteinuria, hypoalbuminemia, edema, and hyperlipidemia. Primary membranous nephropathy is idiopathic, but secondary causes include autoimmune diseases like lupus, infections like hepatitis B, and certain drugs. Other causes of nephrotic syndrome include minimal change disease, more common in children, and focal segmental glomerulosclerosis, which is often seen in adults with hypertension or obesity. Accurate diagnosis through renal biopsy is essential to guide treatment.
What is the characteristic microscopic finding in rheumatic fever myocarditis?
The correct answer is Askoff bodies. Askoff bodies are granulomatous structures found in the myocardium of patients with rheumatic fever. They consist of central areas of fibrinoid necrosis surrounded by immune cells, including macrophages, Anichko cells, lymphocytes, and plasma cells. These lesions result from an autoimmune response triggered by molecular mimicry between group A Streptococcus antigens and host tissues. Rheumatic fever can lead to pancreatitis, affecting the endocardium, myocardium, and pericardium, and is a major cause of valvular heart disease, particularly mitral stenosis. Identifying Askoff bodies is crucial for diagnosing rheumatic fever and differentiating it from other causes of myocarditis. Early treatment of streptococcal infections with antibiotics can prevent this serious complication.
Which artery is most commonly affected in an epidural hematoma?
The correct answer is the middle meningeal artery. An epidural hematoma typically occurs after head trauma that fractures the temporal bone, damaging the middle meningeal artery, which lies in close proximity. This arterial rupture leads to the accumulation of blood between the dura mater and the skull, creating a convex, lens-shaped hematoma on imaging. Patients may experience a transient, lucid interval before rapid neurological deterioration due to increased intracranial pressure. Other arteries, such as the anterior cerebral artery or posterior cerebral artery, are more commonly involved in strokes than in epidural hematomas. Prompt surgical intervention, such as hematoma evacuation, is often required to prevent fatal complications.
Thank you for listening. If our podcast has been valuable to you, we would greatly appreciate it if you could leave us a 5-star rating and write a review on Spotify and Apple Podcasts, or subscribe, like, and share on our YouTube channel. Your support helps us greatly with discoverability. We hope to see you soon.